Good afternoon. It's March 12th, and I'm Dr. Ann Zink, here to provide a brief update on what's happening in Alaska regarding COVID-19. Each day we have a different theme of the day and hope to provide regular information out to you, Alaskans, about what's happening in the state of Alaska. On Monday, our theme was taking care of seniors and elders. On Tuesday, it was the time to act is now. On Wednesday, when the governor declared a state of emergency, it was about new tools in the toolbox and ways that we can work together. And today, Thursday, it's about social distancing and ways that we can protect each other as we see this virus continue to spread around the world. In order to give you additional information, the state has issued an alert, a health emergency alert, to provide information about social distancing. We're encouraging people to take a look at the CDC website, and we will also contain information here on our website with guidance for community mitigation. We're advising Alaskans to implement protection measures and strongly considering implementing moderate activity measures, including social distancing, that can be included in the following ways. First of all, for the general public, it's important to stay at home if you're sick, including if you have respiratory illness. If you develop a fever, stay at home for at least 24 hours after the fever subsides. Stay at least 6 feet away from anyone who's coughing, sneezing, or feeling feverish, and avoid large gatherings and crowds as much as you can. This is the time to stop handshaking, and as mentioned before, you can do an elbow bump. If you live in rural areas, consider limiting non-essential travel to protect your community. It's also a time to think about our high-risk groups, and this includes those over the age of 60, those with underlying heart, lung disease, or diabetes, or other immunocompromising conditions. And you can find a more complete website and more details about medical conditions on our website or the CDC website. If you fit into this higher risk category, it's particularly important that you consider staying at least 6 feet away from other people who are sick, avoiding crowds, as well as considering avoiding cruise travel and non-essential air travel. It's a time for businesses and employees to stay open and working, but considering ways that you can protect yourself as well as the public. Consider using video conferences for meetings when possible, and when not possible, hold meetings in open, well-ventilated spaces. Consider adjusting or postponing large meetings or gatherings, and assess the risk-benefit of travel at this time. Encourage liberal use of leave policies and teleworking options if those make sense. At this time, we are not having any schools closed, but consider adjusting or postponing gatherings that mix between classes, grades, and other schools. Adjust after-school class arrangements to avoid mixing between classes and grades. And consider event planners. For more details, you can take a look at the CDC website that will be linked on our website as well for more details. In this time, we continue to encourage you to stay engaged in what's happening in the state of Alaska. Check out our website at coronavirus.alaska.gov. We appreciate you tuning in and continue to try to get regular updates to all Alaskans. With that, remember that we're stronger together. Stay well, stay active, stay healthy. Thank you.